My life was affected by opioids in a way that you might not expect. In 2014, my dad was prescribed Tylenol 3 after a root canal treatment. He used 2 to 3 tablets as prescribed after the procedure and kept the leftover tablets in his cabinet. About 6 months later one day, my dad started experiencing shoulder pain. Nothing he tried seemed to work to relieve the discomfort, so in order to be able to fall asleep that night, he reached for the Tylenol 3 that he had saved from earlier. And apparently, they really did work. He told my mother that his pain had finally been reduced significantly, and he actually went to bed earlier than usual that night. During his sleep, my father suffered a massive heart attack and passed away. If the Tylenol 3 was not taken that night, perhaps we would have recognized that the pain that my father was experiencing was not normal and that they were signs of a heart attack. My name is Bita, and I'm now a pharmacy graduate from the University of Toronto. Prior to pharmacy school, I had never realized that a medication incident had contributed to the passing of my father. I always saw this situation as my father having a lapse in judgment, taking a prescribed controlled medication for something other than its intended use, and that this had devastating consequences. Today, however, I can see that my dad's misuse of Tylenol 3 was not his fault, but rather an incident involving systemic errors. That's why I took the time to report it to ISMP Canada through medair.ca, a website created for the public to submit reports of medication errors for analysis, learning, and action. My father's story highlights how critical it is to share key safety messages, such as the safe disposal of medications, with patients. Did you know that almost half of Canadians don't know where to take their unwanted medications when they want to get rid of them? Furthermore, this incident shines a light on the importance of opioid stewardship. As we all know, opioids are effective in treating pain, but even a short-term prescription can hold considerable risks. To reduce the risk of opioid-related problems, prescribers should consider trying other options for treating pain and limiting the quantity prescribed whenever possible. Please remember that taking a minute to speak to your patient regarding the safe disposal of medications can save a life. Thank you for listening to my story.